What is the state of your health? Do you have a case of male or female infertility? Have you been told you have a low sperm count? Do you have a prostate problem? Are you a lady suffering from abnormal menstrual problems? Never worry again. Zoe Fertility and Alternative Medical Center has all the answers to your health needs. At Zoe, we treat all kinds of health problems, including erectile dysfunction. Zoe Fertility Center has a state-of-the-art laboratory and an ultrasound scan services available. There's also the total body scan, which scans all your organs in 5 minutes. Yes, you heard right, in 5 minutes. Our pharmacy is well stocked with good and highly efficacious natural medicines, all without side effects. Locate Zoe Fertility and Alternative Medical Center at Adenta New Site, behind the CAF International School, opposite Mechanical Lloyd on the Adenta Ebri Road. At Odoko, we are near Nicolisi Hotel, behind International Needs, Odoko Terrazzo. Call 0205 363614 or 0243 239534. Zoe Fertility and Alternative Medical Center, excellent healthcare, our hallmark.
Hello, dear friends. Welcome to the Zoe Health Talk Show. My name is Dr. Fiao from the Zoe Fertility and Alternative Medical Center. Today, we are talking about sperm abnormalities. Sperm abnormalities. One of the causes of infertility in men, or the main cause of infertility in men, it has to do with abnormalities of the sperm. Abnormalities of the sperm. And when we talk about abnormalities of the sperm, we are talking about various parameters that we look at when we examine a semen in a lab. And so when a semen analysis is done and you look at the various parameters, we look at abnormalities that may be evident that the man has a case of infertility or has difficulty in making a woman pregnant. One of the abnormalities that we look for is that the volume of the semen. The volume of the semen. If the man has low semen volume, sometimes it may be an indication that there may be difficulty in the man's ability to be able to make a woman pregnant. The other thing too is that when you look at the shape of the sperm, you know, the normal sperm has an oval head, and then there is a middle piece and a long tail, so that the sperm will be able to move, and then the head has some, you know, pointed end, which you call the acrosome, which helps to penetrate the egg so that fertilization can take place. Sometimes there may be problems with the shape and structure of the sperm, which can also make it difficult for a man to be able to make a woman pregnant. There are some sperm cells that when you observe in the lab, you notice that the head is abnormally large, or the tails are sort of short and cut off. Sometimes the middle piece is twisted and all that. So when there is an abnormal shape of the sperm, then it may be difficult for the man to be able to make a woman pregnant. The other thing too is that sometimes some of the sperm cells do not move. There is a problem with the motility of the sperm. Now, when a sperm cell is unable to move, it becomes difficult for a man to make a woman pregnant, because we know that for fertilization to take place, first of all, during intercourse, the sperm has to swim along a certain distance, right from the cervix through to the uterus, then into the fallopian tube, where if there is an egg, it can be fertilized. But sometimes when there is problem with the motility of the sperm, in terms of how the sperm moves and all that, if the sperm is unable to move, it makes it difficult to travel along that distance to be able to get close to an egg and then eventually fertilize it. And so once these abnormalities are there, then it makes it difficult for a man to make a woman pregnant. And so sperm abnormalities has to do with the main reason why some men have difficulty in making a woman pregnant. Now, when a man has problems with his sperm, most of the time, until maybe the man has tried to make a woman pregnant over a certain period, he may not know. And so when you are a man, you have tried to make a woman pregnant for a period of 1 year, but pregnancy has not occurred, and maybe the woman has no problem, the woman has her normal menstrual cycle, the woman ovulates every month, there is no fallopian tube blockage, the hormones are working normally and everything. And so once there is no problem with the woman, and as a man you have tried to make the woman pregnant for a period of 1 year and more, and nothing has happened, then it is possible that there may be sperm abnormalities, which either may be that either you have a low sperm count, so that means that the quantity of sperm cells within a semen may be abnormally low, because there is a certain amount of sperm cells that we want in your semen that can make it easier for you to make a woman pregnant. Normally, the quantity ranges between 15 million and above. And so if an analysis is done on your sperm, and then we notice that the count or the quantity of sperm cells that you have in your semen is less than 15 million, chances are that you may have difficulty in making a woman pregnant. It is not that you cannot make a woman pregnant, but your chances may be highly reduced. And so then the sperm count has to be improved so that it makes it easier for you to make a woman pregnant. And so when there's a low sperm count, which is a type of sperm abnormality, then there will be difficulty in you making a woman pregnant. The other thing has to do with the motility that I talked about earlier on. When we check the motility, it has to move within a certain percentage. And so normally if the sperm motility is 50% and above, then your chances are good. But when we check the motility of the sperm and it is quite poor, maybe the progression of the sperm and everything is less than 40% or below or less, so less, then it's very difficult that you can make a woman pregnant. But what are the causes of sperm abnormalities? What are the causes of low sperm count, poor morphology of the sperm, poor motility, and all that? There are various things. Sometimes it may be that you have problem with the hormones that work in regulating the production of the sperm. And so when you have low testosterone level, that can contribute to you having a low sperm count or having problem with the sperm structure and all that. Sometimes the presence of infections in the testicles can damage the testicular cells. And so when the testicular cells are damaged, your production of sperm will be very low. And so you may end up with low sperm count and sometimes abnormal sperm structure. And then eventually it becomes difficult for you to make a woman pregnant. There are certain lifestyles that sometimes you may have as a man that can contribute to you having a problem with your sperms. One is that if you take alcohol excessively, sometimes that may have some effects on the quantity and the quality of sperm that you produce. Sometimes excessive smoking and all that can also have an effect on you. There are certain medications that may have the complication of side effects affecting your sperm production. So certain medications that you may be taking. So if you want to make a woman pregnant and you are taking any medication, you need to talk to your doctor. Let us find out if it may have an effect on your sperm so that it can be changed for you. And then your sperm can have a normal, sperm count and all that. Our time is up. We'll come your way again, God willing. And then we'll talk about various things that has to do with the health of your sperms and all that. Thank you. My name is Dr. Fiao from the Zoe Fertility and Alternative Medical Center. Bye-bye.
What is the state of your health? Do you have a case of male or female infertility? Have you been told you have a low sperm count? Do you have a prostate problem? Are you a lady suffering from abnormal menstrual problems? Never worry again. Zoe Fertility and Alternative Medical Center has all the answers to your health needs. At Zoe, we treat all kinds of health problems, including erectile dysfunction. Zoe Fertility Center has a state-of-the-art laboratory and an ultrasound scan services available. There's also the total body scan, which scans all your organs in 5 minutes. Yes, you heard right, in 5 minutes. Our pharmacy is well stocked with good and highly efficacious natural medicines, all without side effects. Locate Zoe Fertility and Alternative Medical Center at Adenta New Site, behind the CAF International School, opposite Mechanical Lloyd on the Adenta Ebri Road. At Odoko, we are near Nicolizi Hotel, behind International Needs. Odoko Terrazzo. Call 0205 363614 or 0243 239534. Zoe Fertility and Alternative Medical Center, excellent healthcare, our hallmark.